Greetings and welcome to In-Depth. I'm Dike Rostant. World Health Day is observed on April 7, the anniversary of the 1948 founding of the World Health Organization. We are happy to have PAHO, WHO Country Representative Dr. Erica Wheeler, join us to discuss this year's theme of health for all in the main, in addition to other topics. Welcome, Dr. Wheeler. I'm so grateful that you're able to make the time again, because the last time we just simply ran out, so we're able to pass and do a little more increments now. But I want to start off though asking about the specific focus generally of World Health Days, and if that changes any with this iteration 2023.
Well, thank you. Great to be with you again. And yes, every year there is a different theme for World Health Day, and it is meant to focus our attention globally on specific issues. So this year, the theme for World Health Day, Health for All, and you would remember the alma mater back in 1978 was Health for All by the year 2000. But now this Health for All is about strengthening primary health care to build resilient systems. And when we say primary health care, we talk about different levels of care. We talk about the first level of care, which is called the primary level of care. And this is where most persons should get their care, meaning at health centers. That's your first port of call. The reason being, if we have strong primary level care, it means that we can address many of the long-term illnesses that become chronic, like diabetes and hypertension, at an early stage where people can be cared for in the community close to their homes. So this is why the primary level of care is so important. But primary health care as an approach speaks to how we deal with diseases, not just at the primary care level, but how we do referrals, where we do them to, whether to secondary or tertiary care, because the less people that end up in hospitals, the better for the country in terms of the overall health profile of the population. And of course, governments spend far less money if you deal with issues at the primary care level. So this is the focus this year. In addition to which, the building of resilient systems, and that word resilient is very important because we've just been through a pandemic. And we know that many of the essential public health services, whether it be maternal and child health care and care for people with diabetes and hypertension, these have all been affected by the shutting down of economies during the COVID. So it's about refocusing. Yes, we look back as WHO celebrates its 75th year. We look back at all the many successes like eradicating smallpox, building immunization programs that have helped children to be free of diseases like measles, mumps, and rubella. Many things we can be proud of, introducing the expanded program on immunization, all of these things and many more WHO has achieved. But we have to see where we are now and look into the future. This is why the focus is on building resilient systems that can stand up to the assaults like the one we had with COVID-19, which was completely unexpected and hit us out of left field when it did, and left countries all over the world, both developed as well as developing countries, much weaker as a result of the pandemic. So that's the rationale behind this year's theme, Health for All, strengthening primary health care to build resilient systems.
But looking at that focus in terms of primary health care, Dr. Wheeler, how much of that needs to be structures and how much of it is mental? And I cite the case in Tobago specifically, where they're trying to have a shift, and as opposed to just saying, okay, well, primary healthcare centers, talking about wellness centers, with the idea that
Yes.
you go there and to preempt having something present, as opposed to when something presents, then you want to go to a doctor, as opposed to making sure that this is something that you seek and is almost like a lifestyle. So, and it brings a lot of the same issues that you would have mentioned. Okay, well, this is in my area, so I can go somewhere that is close. I don't have to spend all that money to travel or time or traffic. I can free up the healthcare system by staying out of a hospital. So how much of that focus needs to be mental as well as just building those physical structures?
Well, when you say mental, you mean down to the individual, or you mean in terms of
Yes, thank you.
services?
Redound
Sorry.
to the individual. So before
Right.
this pain that I have, nah man, it will sort itself out. I'll say two prayers, drink some bush, or it will resolve itself. Versus no man, and you're seeing something actually spreading and say, no, I need to go and get this checked out. So the individual in addition to the system. So how much of it is on that individual as well?
Well, you more or less said what we would say as well in WHO, that there has to be some individual responsibility. I think particularly as we see the continuing spread of non-communicable diseases, which are lifestyle diseases. So what you're talking about there, it being mental, these are lifestyle diseases that are killing us prematurely across the world, but in the Caribbean, it is, a significant issue. And yes, we have to go back to examining the link between what we eat, what we drink, whether we exercise, all of those things, and our overall physical health. So it is being more conscious, finding out, seeking answers, rather than, as you say, immediately waiting till things get bad and going to the doctor. So it seems as if we have lost that link in many ways, that we don't think consciously of how we live, what we eat, what we drink, what we do with our bodies. So some of it is mental, but when there is a need, because remember things like, let me give you an example, diabetes. There's type 1 diabetes, you're born with it. It's not a lifestyle disease. So having the service to address something like that in young children is vital, and it should be there, and it should be at the primary care level. Type 2 diabetes, which is the most prevalent one, is a lifestyle disease. And it is something in terms of nutrition and exercise you can be taught. Your family, your school, government can run programs. I know right now there is the TT Moves program in Trinidad and Tobago and in other parts of the Caribbean, like Jamaica. So it is true, there is a dual responsibility. On one hand, when the citizen needs a service, it should be available. But on the other hand, we can do a lot to reduce the kinds of illnesses that end up becoming chronic if we take more care, because we did not get here overnight. It took us several decades to get here. So it won't go away. It requires a change of attitude and behavior. And this is why things like obesity is something under our control as well. There's a small percentage of people who may have issues that cause them to become obese, or medication they may be taking that makes them put on weight. But there are many things we can do. We are not helpless in that regard. We can get ourselves into programs, we can educate ourselves about our bodies. So part of it is indeed our own responsibility.
And you say that and it really hits home, because I know someone who's type 2 diabetic, but they said they love the ice cream. So you see, when they feel for the ice cream, so they eat ice cream till their head get numb, and then they boil the bush. And so definitely a change of attitude is needed. But we take a short break. We're speaking with Dr. Erica Wheeler, the country representative for PAHO and WHO. We return with more. Stay with us. Welcome back. We are speaking with PAHO WHO country representative Dr. Erica Wheeler, looking at World Health Day. Health for all is the theme for 2023. But before the day, there was a high-level dialogue. It was titled Health for All, Strengthening Primary Healthcare to Build Resilient Systems, which you would have mentioned that overarching theme in the first half of the conversation, Dr. Wheeler. But when you say high level, who are some of those players involved when you say high level dialogue? And is there any feedback from the engagement that you'd be able to share?
When we speak about high level, we usually speak about ministers of health and their senior personnel. There was a high level dialogue this morning with PAHO in the PAHO region, and there were ministers from the Caribbean there and Latin America. And they each addressed what they were doing in their own countries to mitigate the worst impact of the damage done by non communicable diseases, for example, on the population, the provision of more healthcare services, and importantly, training for healthcare workers. Because, of course, we can talk about services as much as we want, but unless we have competent healthcare workers, we still would not be able to address some of the issues. So that the main themes were around what countries in the Caribbean. The Minister of Health of Guyana was represented from the Caribbean there, and there were other ministers from Latin America. So they focused on the programs that they were strengthening at the primary care level in order to reduce, particularly non communicable diseases, was a big issue there. But mental health, as you would know, is also an issue that has become more prominent because of COVID, because people were isolated from each other for long periods of time. We also will have another high level dialogue coming up on for small island developing states in May in Barbados, looking particularly at non communicable diseases. And there again, there will be ministers and their senior officials, and they will be looking at a range of topics around non communicable diseases. And you may be interested to hear too, even climate change and the link between climate change and NCDs, but they would be looking at gaps in services, what countries still need to be doing to make more progress towards reducing the numbers of persons in their populations dying prematurely from non-communicable diseases. And prematurely means before the age of 70. So whether it be providing more services in new facilities or in the current facilities, strengthening them by upgrading them and by training more healthcare workers, as well as looking at if there's any equipment to be bought, things like that across the board. These are the kinds of issues that they were looking at. But of course, as each country spoke, they addressed their own issues within their context for their populations. But it is ministers of health and their senior officials when we speak about high level meetings.
Thank you so much. Do you think that there's anything that we can use locally here in terms of plug and play from the experiences of members of that meeting, or would it be something that we need to adapt heavily to utilize in order to fit the local scenario?
No, I think to some extent the issues across the Caribbean are very similar and Latin America. It is about what currently exists. So it's about identifying the gaps in services, which we do with the government here, for example. We are doing a lot of work in NCDs with the government. So it's about looking at lessons learned from others and how they can be adapted. But I think in some of the critical areas, we know what needs to be done in Trinidad and Tobago. So it's working alongside the government to strengthen those areas which need strengthening, particularly, as I was saying, at the primary level of care. What additional training needs to be provided? Give you an example of what we have done for with diabetes and hypertension. With hypertension and diabetes, we have something called HEARTS, a HEARTS program, and we began by looking. It's called HEARTS because of stroke. You know, people who have hypertension are more prone to stroke. So we began by looking at training persons within the healthcare sector to strengthen their knowledge of what could be done to help those who suffer from diabetes and hypertension. So we give them skills, and then we train the trainer programs. Then we did self-management courses for persons who are chronic sufferers of diabetes and hypertension, and teach them how to manage their own illness as well. In addition to which, we provided equipment so that patients can take it home and measure their blood pressure and measure their the level of sugar in their blood using the common parlance. So all these are things that we have in common across the Caribbean. So we don't really need a lot of things to adapt, but we can look at what countries are trying, what's successful and what is not. But we always have to bring it back home, because no country's services exact duplication of each other, especially when we come to building competencies amongst health workers. This is where we then have to work with the University of the West Indies, for example, and see how what courses can be offered if they're not being offered now, to improve, to upscale the competencies of the doctors and nurses and midwives and so on. So it's always a joint effort. It's never something done alone. We are here to work with and serve not just the Ministry of Health, but all our stakeholders and partners who can help to improve the quality of life in Trinidad and Tobago.
And I really appreciate, we have 2 minutes more, but I appreciate the fact that it seems as though the approach is broad. Yes, there are a lot of things that it encompasses, but at the same time, it drills down into some of these things, as opposed to saying, okay, well, we're going to touch here, we're going to touch there. But building functional capacity, that one of those last things that you spoke about, I think is so important. But even the way that we're going to be doing that while people are possibly still working, how courses can be developed and devised. Do you get feedback from just governments or the regional health authorities, or where some of the places that you say, okay, well, these are the things we need, these are the people who can provide them, so let's build those bridges?
Well, most certainly we work with the regional health authorities. We cannot do our job unless we work with all 5 regional health authorities in both Trinidad and Tobago. And if necessary, we even work with the members of the Tobago House of Assembly and give them training, which we have done. So we do drill down, because that is part of our responsibility. When we do an analysis of the situation, we do drill down, and then we address those issues, those granular issues. We don't just do a broad brush. Our responsibility is to go deeper and to do the training that's necessary. And we get support not just from our office here, but in Washington, and even sometimes from Geneva as well, WHO headquarters. So yes, there's a lot that we're doing. I can talk about it for hours on end, but I know we have very little time. But certainly, we as WHO, we are looking forward to continuing the work in the midst of this. We still have not declared the COVID. It's still a pandemic, and we still have to be doing work in infectious diseases, which we haven't really touched on. But we want to promote health. We want to provide health by reorienting health systems. We want to protect people's health by strengthening the architecture for health, meaning the health services. And we want the power of harnessing research and innovation to address the very difficult health issues that we've been facing, such as COVID-19.
So we want to thank you for the work that you're doing and continue to do, and we will continue hopefully having conversations with different individuals from within the organization. So thank you very much, Country Representative for PAHO and WHO, Dr. Erica Wheeler. On behalf of the entire news team, I'm Dike Rostant. This has been In Depth with me. Thank you so much for joining us.
Thank you.